It's great to see so many of you joining us. Thank you for joining. We're going to give it another minute for people to arrive. And if you know people who are hoping to attend and they're using their phone number, just so you know, Dawu is going to be texting them and making sure that they're really joining this group just to avoid any Zoom bombing. So again, thank you for joining us here today. I am going to start sharing my screen. And you should be able to see it now. And then somehow everybody else disappeared on my screen. So I won't be able to see the chat. All right. So my name is Ali Alvarez. I'm the Director of Wellbeing at Stanford and also the Chair of the Wellness Committee. Welcome and thank you for joining us. Good morning or good afternoon, wherever you're coming from. And today we're going to be chatting about Beyond Pizza and Burnouts, a real focus on professional fulfillment and also personal fulfillment, instead of just focusing on burnouts, which many of us are used to talking. And so I'm going to be driving this. I'm going to allow each of our team to introduce themselves. I'm going to start with Dr. Deutsch.
Hi, good afternoon or morning. I'm Amanda Deutsch. I'm the current Wellness Fellow at Stanford Emergency Medicine, and I'm very excited to be here.
Dr. Wagan.
Hello, everyone. I'm Logan Wyant. I'm at Hopkins, and I am our departmental wellness chairperson.
Dr. Sun.
Hi, everybody. I'm Wendy Stein, one of the chief residents at Yale.
Dr. Stamen.
Hi, Christine Stamen. I'm the Director of Wellness Education at University of Illinois College of Medicine, Peoria.
And Dr. Corelius.
Hi, I'm Vitas. I'm one of the Stanford Medical Education Scholarship Fellows.
All right. And so as you have just heard, we're pretty much first name basis. And so from now on, I just want to set the stage that we can chat using our first names. And so this is just a slide to remind us of the professional fulfillment model. There's many other models out there to talk about wellness and burnouts. For us, we're going to be using today the Stanford Professional Fulfillment Model, specifically to understand that there's many areas that we can address in order to get this sense of fulfillment. I want to highlight a couple of things here. The culture of wellness and the efficiencies of practice are in red, meaning that it's not just the individual's role to achieve that, it's actually the institution or the organization that has to do some effort. And so each of us will own some topics here and we'll be sharing that. And also included in this is personal resilience. And this is not to say that we're not already resilient people. This is to remind us that in as much as there's a lot of efforts being done from the institution organizational level, we also have a role in this and how we show up and how we can get to that professional fulfillment level that we want to achieve. This is a slide from the AMA in their Steps Forward efforts. It's really about getting rid of stupid stuff or gross. And hopefully today, when in our discussions, you'll figure out some ways that you can get rid of in the workplace that you're at, in the personal aspects that you show up in the work that you do. And so without further ado, I'm going to be starting us off with efficiency of practice in the culture of wellness, specifically on supportive leadership behaviors.
Thank you so much, Dr. Alvarez. All right, so I'm really excited to get to talk about the efficiency of practice and the blend with culture of wellness, really specifically through leadership support. Sometimes people find that this is the area that seems, I think, harder or like they have less control of in order to impact their own professional fulfillment or personal fulfillment, as we're speaking about. But I truly see these areas as erasing the line between them. I know the graphic already has the arrows that are pointing to both of these blending together. And I think that's so helpful to me, because to me, this really do blend together to make them work together. The way that I see this is the intersection of operations or clinical administration and that leadership support that comes together to make wellness go forward. This looks different everywhere you go. However, what I think remains most true with emergency medicine is that people want to work together. We went into this to be a part of a team, and I think that's one of the best ways we can move forward with operations, administration, quality improvement, and wellness really working together. So I'll share some of the ways that I've come across this personally to encourage that engagement and partnership to move these forward. Some of this comes with repurposing or finding those common needs you can work together for. And that way you can hopefully already actually use the systems in place and not have to rebuild everything from scratch. So for example, when I was in residency, one of the ways I was able to do this was really leveraging a quality improvement project that I was doing through the hospital. And this way it wasn't hard for teams to agree upon really working together, because it was something that already had a little bit of support behind it. They wanted us to do quality improvement projects, but I was able to make this a blend of an educational, informatics, administration, and wellness project. And that way you had so much support coming through, and it's ways that you can move things forward in that way. And so I think if you're already thinking of different ways that if you're a resident here or if you're residency leadership, if you find people that already have that interest in doing wellness or quality improvement, see if you can find something that works together, even if it's little, because it can have a huge impact. Another way that I really think about this is how we can redesign both physical and electronic things together through partnership. And so I think these are some of those areas we can that are maybe easier to imagine as efficiency of practice, especially if the EHR and new documentation guidelines that are out there partner with your epics and informatics team to really be able to move this forward. I think that's part of the fun of doing this too. One of those that I think of, and hopefully a lot of people already have this. If you don't have a shared note, that's one of those easy, impactful ways that you can start to work together, because it's giving you educational as well as wellness and informatics to work together. A huge portion of this, and I was happy to see in the chat that my new chair is on here, is really partnering with the administration and clinical operations teams. To some places, this probably doesn't seem new at all to do. Some, it might be a really new concept. So ask if you're already not a part of that. Dr. Alvarez and I have already joined our administration meetings, and everyone was happy when we wanted to. It's a really great way to get the pulse of what you might not hear is going on in the department when you're just sitting in your own wellness meetings. And it's a way to move forward and be able to work together, see what the residency leadership needs, what your operation teams think they need right now, and have that really insightful and fun way to be able to come in there and say, actually, we have some ways that we can help impact that. And beyond just your administration and ClinOps teams, don't forget to use your nursing leadership as well. This way you're helping to create those stronger team dynamics in your department. And you're really, again, providing that leverage. We were able to do this to help us with some grief counseling groups that right now we get to work with by our nursing leadership. They really provided that impactful, both monetary portion that they were able to help us so that we can get this. And they were psyched and they're a huge portion of this now. And lastly, another huge thing that I think leadership support obviously comes behind is really helping create the boundaries so that you can do those things that need to be done, but also really helps create that portion where you can find your own personal fulfillment here. And so I think if you're a leader, whether that's just that you're an attending and you lead in that way, you're a residency director, you are your admin or your wellness leader, whatever your role might be, we can start to really model great behaviors such as taking vacation, putting up away messages when you're doing this. Dr. Alvarez is the king, I think, of this, of truly telling you what he's doing, like that he's down the slopes in Japan right now. So he'll get back to you when he has Wi-Fi. But really normalizing those things so that you can have that support, and that as if you start to show that you do that, so too will the residents feel like they can do that when they need to. And that when we have our own precious time away from work as well. And even something as simple as normalizing what hours you're going to send emails out, I think is huge. So whatever way your department can, ask it and partner with leadership. It's huge. It's important. I think you'll find that leadership wants you to be a partner as well. And this way you can promote your own culture of well-being, but most importantly, your own personal and professional fulfillment. Thank you.
So I'm continuing on what Amanda talked about related to the culture of wellness and talking about appreciation recognition, which obviously does weigh in somewhat with your administration as well. But next slide, please, LA. So if you notice within the culture of wellness, they actually have a bullet point under that that says recognition and appreciation. And during these few minutes, we're going to touch base on this section, why we should care about this little bullet point and how we can use it to improve our professional fulfillment. This bullet point is really about relationship and human connection, which is part of medicine, right? That's an integral part of medicine. So it's about people noticing and caring that we're working hard or simply that we're still here. Next. So, sorry. First, we need to differentiate between these two words and add a different one. So while they may at times be used interchangeably, they relate to actually different things. Appreciation is about who someone is. You are awesome. And recognition is about what they have done. You did something awesome. Click. To show appreciation and recognition, go ahead again, LA, sorry. And then the third one. To show appreciation and recognition is to show gratitude to the person for either their value, appreciation, or what they have done, recognition. Next. So as high achieving people we've been recognized via high grades and awards our entire lives. Occasionally we were appreciated as well, like awards for being a good person. But getting this recognition and appreciation seems to get harder and harder the further we get into life, and the time between receiving expressions of gratitude becomes further and further apart, or it feels like it. But the question comes down to, does feeling appreciated and recognized really make a difference? Next. It actually does. The research on gratitude goes back to the 1960s, and we know that feelings of gratitude increase subjective well-being, positive emotions, health, and pro-social behaviors, while allowing those who feel gratitude to savor positive experiences, cope with stressful circumstances, and have stronger relationships. Next. More recent research has looked into how receiving gratitude affects the helpers, those who did the thing or were the person that the beneficiaries are grateful for. Research suggests that receiving gratitude enhances agency, click LA, feeling personally competent and capable, in that it enhances feelings of self-efficacy, reducing their feelings of inability to help effectively. And more importantly, especially in our jobs, receiving expressions of gratitude increases helpers' feelings of social worth, realizing that their efforts are recognized by the people they're helping, and they are more likely to continue to help. Go ahead, LA. Finally, a more recent article by a group of, I believe, Israeli scientists who had previously looked at incivility or rudeness and teamwork. They looked at the effects of expressions of gratitude on team performance and found that after receiving an expression of gratitude, teams and healthcare workers, go ahead and click LA, teams of healthcare workers shared the workload and information better, resulting in improved diagnostic and treatment performance in caring for sick children. Click. Hearing that you've made a positive difference in someone's life actually makes you more capable of providing high quality care. Click. And next. So gratitude makes a difference, but do you notice when someone expresses gratitude towards you, or do you brush it off, ignore it, diminish it, or dismiss it? Which most of the time I feel like we do. Somebody says thanks, and we just kind of like, oh yeah, that's what I do. Thanks, bye. Go ahead. So how can you control getting recognized and appreciated? According to Rob Orman in his recent talk at Cord, you have to act in a way that's worthy of appreciation and be open, receptive, and present when it happens. So he suggests writing down or saying before every shift, I'm open to accepting gratitude from my patients and staff. And some of that is really your attitude. Like if you're open to it, it's the same thing as if you have a smile on your face when you start a shift, everybody else is going to have a more positive day. Whereas if you are totally down, everybody else is likely to have a bad day. So does anybody have any thoughts on how they prepare to receive recognition and appreciation, or do we kind of like just all blow it off and dismiss it? Okay, well, I'm apparently the the test one. Stephanie says she definitely dismissed it. She hates getting compliments. Well, maybe we need to work on it, especially if it's going to make us better. So then the next question is, how do you set up a system of recognition and appreciation? At my shop, for at least the residents and attendings, we have a QR code and a website that's a Google form that just says, here I am, this is who I am, and I want everybody to know that this person is or did something awesome, or I want to be anonymous, and they get points for their wellness houses that we do. We also just keep an ear out. So the other day I was working and one of my nurses made a comment about one of my residents about how he did something really awesome. He was worried about a patient and the patient had to go home because his kids were sick, and he called the patient's wife and made sure that he had childcare coverage. And actually he went and got the patient to bring the patient back, and the patient ended up in the ICU. So we're all very thankful, but it's like escalated to administration because we were able to catch it and notice it. Right? So he's getting the positive recognition, because so many times we get negative recognition. The patients complain, the nurses say we did something wrong, you screw something up, but having the positive one really makes a big difference. It is sometimes uncomfortable because it feels like it's part of your job, but you know what? Part of your job is actually, it's nice to be told that you did something right, or somebody notices that you're actually still here. I mean, remember 3 years ago during the beginning of the pandemic when all the specialties are like, after the pandemic, I promised to blah, blah, blah. And how quickly that went out the door. For 5 minutes, they recognized that we as emergency docs were doing a bunch of really hard work and it felt really good. And now they've completely forgotten about it. So think about it and go ahead next. If you are interested, there's actually a seminar or a session at SAM about workplace appreciation and talking about this. So take the time and on Wednesday afternoon, if you're not joining us for any of the other sessions, and join us for that one to hear more about it.
Thanks, Christine. I would just say that I'll pause here a little bit because there's magic going on in the chat. There's people kind of sharing how tough it is because of imposterism, and just feeling awkward about receiving the gratitude that people share with us when recognizing the work that we do. How do you, like, what have you learned when you do this? Because I can imagine that imposterism is very common, especially in medicine. And oftentimes, I don't know about you, but there's this sense that we have to explain why we shouldn't have gotten that, or like we downplay it a little bit. My coach tells me to just say thank you, period.
I definitely just say thank you. And more importantly, I've started to notice how I feel after I get it. So for example, during our senior residents admin month, they do a certain number of pediatric shifts because we have a separate pediatric ER. And one of my residents basically said, I'm here because I got to pick my shifts and you're working today. And so I chose to work with you. And I just said, thank you, really, because that starts my whole shift off at a really good rate, right? So think about how you feel when it happens, and it may feel a little awkward, but it kind of like you got a little fire in your belly, right? It feels really good. And that means that you have a more positive attitude and the whole shift might go better. And I have to be honest, that shift, I saw 3+ patients an hour that shift, and it was kind of a miserable shift. But as a result, the nurse is like, you're always so calm on shift. I don't mind it when the ship is sinking because you're just kind of hanging out, just having a good time. So, you know, it translates into everything and it makes everything a little bit better. And so it's something little, and maybe at the same time, take a time to say thank you to somebody else, or, hey, you're awesome.
I was just going to say that. I was going to say, I do the thank you and, because like I'm equally awkward about still receiving positive compliments, but I'm like, and I say like, why couldn't I have done it without them, or what I noticed about them. And it's such a fun way to see it pay forward and see how it affects other people.
Amanda is definitely an expert in gratitude. She's done a lot of work on this. I will say that I still get awkward when I have to say ands, because I want to make sure that it's also authentic. And so again, my coach tells me, thank you, period. And then just embrace that discomfort of like, I know you're trying to say, like, trying to explain why or shouldn't be you. Thank you. All right, let's move on to belonging and community building.
Awesome. Thank you, Dr. Alvarez.
Oh my gosh, LA.
LA. So the next section we're moving on to is belonging and community building, specifically under personal resilience and culture of wellness. As you can remember from that professional fulfillment circle, having that sense of belonging and community building is not only, something to work on personally, but also it's something that systemically kind of your work organization should focus on in order to create this culture of community. So it's not up to the individual, but kind of up to everybody. And so next slide, please. So belonging is defined by the Cambridge Dictionary is a feeling of being happy or comfortable as part of a particular group and having a good relationship with the other members of the group because they welcome you and accept you. So this is especially important because, next slide, please. In the most recent McKinsey survey conducted in 2021, which is also known as the Great Attrition survey, since that was, kind of during the pandemic and when everyone was leaving their jobs, it really showed that 51% of all departing employees attributed their resignation to a lack of feeling belonging. And so this kind of tells us that belongingness is especially important area to target, especially kind of with our ongoing workforce kind of discussions, and especially knowing that even before the pandemic, attrition within emergency medicine is 5%, and we suspect that to be higher, after the pandemic. Next slide, please. So here I have a picture of a black hole because on doing a preliminary literature search, there is a void in evidence-based interventions that improve the sense of belongingness, which means that together we still, have a long way to go. However, this is where I want to kind of make this interactive. Here is where I task everyone to think about kind of programs and share them with the group of what you guys do at your own institutions that you feel have created belongingness and kind of increase your general wellness as you go to work, or, even with your off work, that you feel that connection with your peers. So feel free to put that in the chat and we can certainly discuss more. For me personally, next slide, please. I found that my personal well-being and kind of feeling of belongingness has been augmented by a mentorship program. And so the mentorship program we currently have is that when you're a resident, you have a mentorship faculty that you kind of have throughout the 4 years that you're here. And to me, having that continuity, having someone, who truly cares and kind of appreciate you as a resident and also part of that journey and growth has been really instrumental. And mentorship, as we kind of know, and there's been research on this, has been helpful in career longevity as well, because not only does the person benefiting from the mentorship kind of receive that satisfaction, but for the mentors who are giving back, kind of seeing that growth also brings kind of professional fulfillment. And the other kind of program that we have is a buddy system where it's more of a peer-to-peer kind of mentorship. And this was really started during COVID when, social isolation occurred more frequently because we were all cohorted and we weren't working on shift together. And so this buddy system was really like you have one other buddy and, you're responsible for each other. And because there are only like 2 or 3 people in each group, that it's up to you to reach out to your buddy and ensure that they're okay. And, this is, since COVID started, we've continued doing this, and it's like really continued on where these cohorts of buddies have really did go through a lot during COVID and have that bond and have that sense of belonging because they found that their buddy is someone that they can turn to. And last but not least, for affinity groups, they've also been really helpful in cultivating a sense of belonging and community. So one of the examples is that we have a Women of Yale EM. And what I want to point out with affinity groups, and this is like where the system is more important, is in that in creating kind of intentional programming, having kind of leadership is support is very important, because oftentimes events or programs require funding and requires kind of also appreciation for the person and recognition for the person who's running this. And additionally, it's also very intentional. For a lot of these events, we make sure that, you know, specific groups of folks have time off from their clinical schedule, so it's easier for everyone to gather. And so in a lot of these kind of programs, there's definitely intentionality involved. And this is why kind of, you know, what Amanda was saying earlier, having that, you know, admin leadership buy-in is so important in ensuring that there is success in the program that we're doing. So I'm really excited to see that the chat's, you know, going off. So I'm just gonna take a look to see what folks have written. Yeah, I love that. So, you know, people checking in after a tough shift, I think that's really important. And similar to like the appreciation gratitude, sometimes all it takes is, you know, 1 or 2 sentences to reach out to say you appreciate someone, where if you notice that someone's going through something, to say, hey, you know, how are you doing? And like reaching out like that is really important. And Stephanie said, I like the t-shirts they made us, X institution strong. Yeah, certainly kind of having something symbolic to bring everyone together is really important. Yep, and Logan mentioned affinity groups like rainbow dinners, feminine EM, happy hours. And then, newsletters that include celebrations of new family member instead of just logistics. I think that's so important. I like this year, I was really excited that our residency family is growing. So I've always ended my block emails with babies of new residents that are joining us. Yeah, residency families are another important way. And oftentimes too, like, you know, I found that through all these kind of programs, they're just the beginning of a larger work, like kind of, it kind of snowballs in a way, because once you implement it, kind of people talk to each other, and then it kind of snowballs after that. I love that. And Christine mentioned we're planning a staff retreat focusing on wellness and gratitude to kick off staff appreciation. I think especially as, you know, COVID, the pandemic has improved, and we've gathered more, having that in-person gathering has been more important in ensuring that we cultivate a sense of belonging and community. So I love all of this. And that's pretty much it. And I think, you know, this is definitely an ongoing discussion, and certainly, you know, what I'd love to see is in the future next steps in terms of kind of implementing and actually quantifying whether there is like evidence-based kind of work in that, whether certain interventions work or not. And I think we are on the path to that, which is really exciting. Thanks.
Yeah, I really like, thanks, Wendy. I really like what you said just now as well, right? Like, there's a lot of inspired people here. Clearly, you're taking the time, many of you, either your lunchtime, your afternoon session, to join this conversation. And we also try, and as you can see in the chat, there's a lot of different activities that are being done. And yet, when you looked at evidence behind this, there's not a lot out there, which really is an opportunity for us to explore, and also like put a dent and give some evidence. I think what's also important is having people who are really passionate about the work, do the work, and also have people who are very passionate about research, do the research behind it, right? So having them align their passions with what they're really good at, because I can imagine that some people will hate doing the research on this, and some people will hate doing the planning of events, and are very much better with give me the logistics and I'll work on that. So I think figuring that out is also very important. So thank you.
I love that. Thanks for highlighting it. Get a buddy, you know, to help each other out in events in advancing wellness.
I like what you did there.
And so this is one of the abstracts that we have at SAM. It's about on-shift break-taking behaviors of resident emergency physicians. So if you're at SAM, please check out our gap analysis study on physician well-being and taking breaks. Thanks.
I would just want to highlight here that this is, by the way, congratulations on that top 100 abstract. And this is one of them, right? Like we had a conversation about are there enough evidence out there for risk break-taking behaviors amongst residents? And we thought there was, and then Wendy and team looked into it, and there's actually not a lot. And then next thing you know, they did a survey, a national survey across like several other residency programs, and now they're presenting it. I hope you know that there's also ways to do that in many of these areas of professional fulfillment within us here at the Wellness Committee, and also just on your own, and definitely partner with us because there's a lot of very interested people in our group.
Yeah, and in a way, that's like, you know, my community. It's like when we had this idea, I brought it within SAM, and because of the community that we built here, it was like kind of fun to do this project together. So in a way that increased my personal wellness because I have that support system with you guys.
All right, let's talk about safety net support systems, as you mentioned, and then the Stop the Stigma EM.
Sorry, I don't mean to be the dark cloud after all this positivity. But I'm going to talk just briefly at a different portion of this professional fulfillment wheel, focusing more on the self-care assessment and support systems and kind of safety net systems for when we do have crisis, because innately, especially in our line of work, that does occur. And so part of having, I guess, a department that will facilitate this professional fulfillment and growth and safety is, and also having a system in place for when things go awry. So next slide. So I stole this from actually the AMA and I think the AAMC, where they use the stress continuum model of kind of when to intervene. And they use the term stress first aid and kind of, you know, at some point along this continuum of stress that we are constantly receiving in our day-to-day work in the department, as well as in academia, we get to this portion where we're either injured or already ill, and kind of the ability to intervene with different types of safety net mechanisms or support systems at this injured phase can prevent us from getting to this ill, where we kind of have some more deleterious kind of effects. Next slide. And so this is just a different way to kind of visualize this same model of the stress first aid, where we have a crisis and that this, you know, results in some stresses, whether that be, you know, feelings of personal safety, things outside of work, overwork, loss, and then kind of we have these pre-existing institutional supports on a regular basis that kind of help with those stresses, but sometimes we're unable to overcome those and still have some stress injury. And if we have that stress injury and we kind of don't have any safety net support systems in place, or in their terms, stress first aid, you know, we potentially could end up to having kind of more chronic stress reaction, leading to burnout, leading to, you know, loss of attrition, and lots of other more worse things like poor mental health. And so the stress first aid kind of helps us kind of have a safety net to kind of focus more on recovery and getting back into thriving. Next slide. So I'm sure a lot of the institutions that we're all at have some safety mechanisms in place. I'd love to hear kind of from the group about different kind of support systems or safety net systems that departments have enacted or have in place to kind of help prevent kind of the stress injury from leading to kind of the permanent stress reaction that we sometimes experience at work. You can, next slide. Oh.
You saw a preview of the answer, but I'm sure that several of you have had experience with this, like peer support or with COVID response, for instance. In the Bay Area, we have a bunch of disasters recently, including really bad storms. And I think pivoting from COVID response to even disaster response in our department has been helpful, and also kind of gave some people a different sense of meaning with their work, because then they're using some of their energy with checking in with people. I wonder how else are people doing this from an institutional level.
Well, I put up some examples of some different things that we've done within our institution, or seen at some peer institutions, but some different institutional interventions that people can have are things like opt-out mental health care or counseling versus opt-in has been shown to be pretty effective. Other interventions are things like unit debriefs. An example of that is the CARA group, who does these healing sessions over tough cases in our department, especially very tough traumas, has been really helpful for the residents, physicians, and nursing staff whenever a bad case comes into our ED. Also having some kind of formalized peer resource network, as kind of Wendy had talked about, can be really helpful. And then something Stanford specific for us is the 24/7 Well Connect, which gives us access to 24/7 resources for wellness and mental health. I've seen some peer institutions like mental health crisis teams within the institution that are completely confidential and provide like support and have referral lines to speak to like a peer, like another physician who's trained in kind of counseling, or at least kind of intercepting another physician when they're in crisis or having like a mental health issue, and kind of helping facilitate them finding help or care, or navigating whatever they're going through within their department. And then you know, I think it's becoming more of a standard, but having 24/7 access to psychiatry services has been something that we're seeing a lot more of right now. And then telepsychiatry, just given that it is so hard to get access to psychiatrists these days. But with the advent of COVID and everything going virtual, we're finding that perhaps telepsychiatry would offer a better solution to being able to make the kind of mental health services a little bit more accessible, especially for busy physicians and residents. We're balancing a lot of things at home as well as at work. So.
Actually, I think the chat blew up after you started speaking. So do you want to address some of them? Amanda,
Sure.
you unmute as well.
Yeah. Well, I was going to say, while you're reading those, Vitas, I'll even speak up to what Stephanie just wrote, because I think that's such a huge one. I always think of this, you know, in these exact crises moments, like really hard cases and things like that. But Stephanie kind of just reminded me of what our medical director really does on just when he notices the boarding is about to be out of control and the lobbies hit like 45. And I think Vitas and LA could speak to this too, but we like receive a message, those residents and attendings that are on, of just like, hey, it's going to be a tough day. Checking in with you guys, let me know if you need anything. And it really does, even though it's a group text, it feels really nice to have that personal check-in and kind of the heads up of, ooh, I'm going to walk into an on fire ED, but someone knows this, they're looking out for us, we're not in this alone. And all of a sudden you have all the attendings texts that are on with you. And just that little check-in really does do a lot more too. So that was all I was going to speak up about.
Michelle had said that they have a psychologist who comes in for big real-time debriefs, which would be amazing. I'd be curious to hear, is that like a colleague within kind of the department who's kind of volunteering that time, or is that something more structured that you guys have received support from your institution for? That's pretty impressive, and I think would be really powerful.
I'm not sure where her like financial support comes to provide this, but you know, I would say, I mean, obviously many of us are used to seeing many different stressful scenarios that could cause grief or crisis on a regular basis. So this is really more for some of the big events, like when we've had mass casualty or really significant pediatric trauma and death. I mean, the ones that still get all of us even after 20 years of practice. But she is essentially like on call for the department. I mean, she is employed through the School of Medicine, and she has partnered in a lot of different projects with emergency medicine. Her focus actually is emergency psychiatry. And she does a lot with PTSD. So she's like really an ideal person to come in, but she is also on call for our department. I think everybody knows how to reach her if you need her, and she'll kind of make herself available and help link to care if that's what's needed. Because I think, as you were mentioning earlier, you know, especially during the pandemic and still now, it's really hard to get people linked to care, like who needed, you know, who felt like they needed some assistance. And so she also is sort of like a next layer to try to help bridge that gap to treatment for folks. And it's nice because she's, I think, familiar enough with the crises of emergency medicine to really have a lot of empathy and really understand, but she's removed enough from her perspective, you know, from a psychology background to, you know, really provide people with resources. And she does typically at least 2 or 3 times a year too. She'll do kind of big safe space debriefings with the residents, just allowing them a space and a place to talk about things that, you know, are still sitting with them, or, you know, situations where they really felt like things, you know, they weren't heard, or that the situation really could have had potentially a different outcome, you know, if the whole team had really been cohesive.
That's awesome.
Yeah, that's certainly one of the things that we learned as well, with healing sessions, for instance, and big events. A couple of things. When we work with the Cara grief team, and then I'll share with you their information in the chat. What they found is that it's actually it's not helpful to talk about the trauma within 24 hours because it's still traumatic for people. They really need that space to take a breather. So creating diffusing sessions to just talk about emotions and how to handle that is helpful. But beyond that, processing is not helpful within the first 24 hours is what they found. They found that the sweet spot is between 24 hours to 72 hours. And so that's when they would, for us, somebody will reach out. We're piloting something to reach out to people if they're involved in like a traumatic death. That way, within that time frame, they know that somebody is checking in with them. I saw a question from Cindy about if there's any data about being utilized for these. What we learned from the Stop the Stigma EM campaign is that as physicians, we're really terrible with help-seeking behaviors. We think that we can handle everything. And that is also the case. Even here at Stanford, I'm part of the peer resource network and one of the peer supporters. And I can honestly tell you, we have less than 10 a month for the entire institution that reaches out and asks for peer support. And these are legally protected, confidential, peer-to-peer conversations. And we advertise this freely. You see this everywhere, and yet people don't take advantage of them for all the other stigma, and also again that the belief that as physicians we don't need help. And so I love some of these like opt-out mental health programs. I know that Greg Goldner has done some of that at his institution to really normalize many of these experiences. Amanda, do you want to talk more about this? Because I know you've done work on this and Stop the Stigma EM.
Well, I love that you brought up Greg's program, because I think opting out, if the more we can do that, and Elaine and I have looked into it, it's hard to get that at every institution, is huge. But yeah, I think Michelle was already hitting on that this specifically trained psychologist in their group. That's so important, because one of the huge barriers that we learned with Stop the Stigma EM and speaking to emergency psychiatrists trained in this is that we are great. We will all keep working and our work won't suffer. That's not what will even show you that any of us are struggling. You might be shorter at sign out and more agitated, but also we're bad about picking out our own help because we're afraid. Maybe they're not trained. They don't understand the medical jargon, let alone emergency medicine jargon. And so even to Cindy, your latest question about coaching that you asked, I would say probably the same thing. I know it's a little bit different to think of how finding your own therapist, but keep doing it, keep going on those dates with your therapist, so to speak, as I think of it, to find that perfect match. And it's hard. I remember in residency trying to find a therapist just to be like, oh, I'm an emergency medicine doctor. Like I should do this. And like struck out. And, but I think it's our job as all of us to show that we want to be better and to do these as preventative measures, not just wait for these crises that Vitas is amazingly taking the hard part of taking the more dismal approach here, but of like, we need to step in before it's those crises matter. So I love this.
And then this was just a slide to act kind of as a reminder that even if our own institution, if we don't have necessarily the safety net system or support system that we were hoping for, there's always outside resources and organizations. And so basically you want, the goal is to make finding help easy for our peers and our physicians. So and that's that. And I want to make sure that Logan gets a chance to talk. So.
Great. Here are some other talks that we have for SAM. There's going to be a talk on peer support. Clearly, this is some interest of in the group here. There's a Stop the Stigma EM discussion as well, sharing stories of people's experiences, and also just the Stop the Stigma EM campaign that's Amanda and team have led at the national level. Here's another talk on do no harm and taking care of yourself, especially in the context of physician suicide. So I'll briefly talk about values alignments. I think this area falls into the culture of wellness in that wheel of professional fulfillment. And in my role as the co-lead of the human potential team, most of my work is actually helping people see their alignment with their own core values and the alignment within the institution. I've been in several roles in my career that when I'm not aligned with the institution, I am gonna be the troublemaker. And that's not easy to navigate, especially depending on whatever personalities you have. And certainly, as Cindy alluded to, coaching is helpful. And also going through different coaches to find that right match, as Amanda was sharing. For me, alignment really means whether or not the work that I'm doing sparks joy for me. If you give me a task, if you give me a project that I really don't have the right skills, or I don't have, I don't understand it as well, it's probably not going to go so well. At the same time, what I've learned over the years is that alignment can mean I don't have to do all of the parts of that project alone, as Wendy was referring to earlier. I can work with different groups, buddies. I've worked with Christine, for instance, Christine Stamen, and we've done several work over the years because we know each other's values, we know each other's strengths, and we know each other's weaknesses. And so figuring that out is helpful in order to then kind of just focus on the areas that I'm really good at, while also learning from the people that I get to work with in this talk, for instance, and understanding that one person does not have to do all of the presentation. One person doesn't have to do all the work for one project. So I just wanted to highlight here the idea of alignment. And one exercise that I've learned is to really step back and reflect. So I recently read about this concept of checking in with yourself every quarter. So your quarterly report, and ask yourself all of the things that you've done over the past quarter, and then you can be objective. You can look at all the entries in your calendar. How many of those actually sparked joy for you? How many of them actually created energy for you? And how many of them actually depleted your energy? Like you were dreading to show up in those meetings. You were dreading during the time you were there, and you were dreading continuing more meetings about that particular topic. And for me, alignment means pivoting, being able to say, you know what, this no longer sparks joy. Why don't I find another person for you and helping them kind of take over that? Because that will be great. It also helps. Maybe some people really, really love IRB. So I'll give an example. I fired myself 2 weeks ago on IRB because they started asking me about this data risk assessment or something, which I'm fine. Like I fill out the form, but then they ask more questions, and it's really slowing me down into actually getting to focus on the actual research. And so I fired myself. I hired a person that was actually super excited about IRB, and they actually do exist. And so now our IRB is submitted, and now I can really focus on the logistics of the research. And so I think being able to find alignment in what you do, and also being able to say no on the things that no longer spark joy, has been very helpful for me. I'm going to move on to the next topic because I have a feeling that we're going to have more conversations about this. So Logan, take it away.
Thank you so much, Ale. So we're going to pivot just a slight bit here to discuss a bit the alignment between wellness efforts and DEI. One of the things is, if we don't consider people as individuals, we run the risk that wellness efforts might actually increase gaps and disparities. And so I think it deserves a seat at the table here. On the next slide, this will also add a little bit of color to the discussion. As one author states, we simply cannot expect our healthcare workforce, faculty, and physicians to be well if they are experiencing exclusion and inequality. So I just want to throw it out to the group. Have you ever felt excluded in your own work environments? I can tell you, certainly as a med student and not being out, I experienced sometimes that I felt very excluded. Anybody else have those kinds of experiences along the way? Even not in the department, but at social activities, wellness hours, things like that. Have you ever had any like exclusionary experiences? And I'll sort of let the chat run. I know we're kind of tight on time. Interesting. Kristen says, yeah, at her old job, she didn't fit well with their culture. I think, you know, inclusion is a really important part of culture, and it's something that we really need to actively focus on. And so I'm going to let the chat run, but over the next few slides, we're just going to kind of touch on some of the highlights of that interface between equity, inclusion, and wellness. So, you know, we've heard some fantastic ideas and how important supportive leadership is. And I think it's really important that leadership share values of both physician well-being and equity and inclusion. They go hand in hand. Obviously, mission statements are important, but as we know, they should be aspirational and not declarative. And I really think they should focus on that interface between wellness, equity, and inclusion. Finally, it's really important to collect data because it's very difficult to ensure equity without measuring things. And so looking at things like promotion, awards, et cetera, through the lens of diversity, equity, inclusion is really important. Are there any folks out there with departmental efforts to enhance wellness through equity and inclusion? If so, please throw it in the chat. If not, we'll move on because I know we're tight on time. I also sort of want to highlight this idea of individualities. You know, by truly recognizing people as individuals, not as just simply employees, we encourage them to show up as their whole selves and not to hide certain identities or unique traits and characteristics. I think it's very important to avoid assimilation and really celebrate individuality. And when we think of departmental policies and procedures, things like dress codes, we really need to think about how those might either support or suppress that individuality, because with that individuality, we can celebrate all kinds of diversity. There are many different kinds of diversity that you can see with the eye. However, if we want to really discuss diversity and inclusivity in an effective manner, we need to understand that diversity is not just skin deep, and that it is multifaceted, and there's intersectionality. So I have a couple of questions here. I'm gonna throw them out there. Are there DEI efforts in your department that support all kinds of diversity, or have they ever felt exclusionary? I'm just going to take a second to catch up on the chat.
Yeah, it's almost as if it's worse when you feel excluded than efforts to include people. And in my recent discussions with my chair, a big focus is actually on fairness, and not just on equity, but also fairness of the work that we do. Because when we forget to include somebody, let's say we were giving so in the recognition piece earlier, when you recognize the people and then you miss one person, that one person is gonna feel a lot worse, even though the 5 other that got recognized felt really great about it. And so we have to just be mindful of that.
Yeah, absolutely. And I think as Michelle points out, like being included is a big part of personal and professional fulfillment. And so if there are things that occur that are exclusionary, they can really work against these efforts. And it looks like Anne says that they make sure to include disability in discussion of diversity and equity. I think, yes, ability is a very important part of the discussion. You know, anything race, gender, sexuality, ethnicity, religion, socioeconomic background, I think is something that's rarely discussed. These are all forms of diversity and richness. And when people bring these forms of diversity to the table, I think we all benefit. So moving on, not only do we all have distinct identities, but our identities may change, and those identities may change and needs may change along a person's lifetime. Considering policies that support care for family along the spectrum, things like parental leave, time for elder care, bereavement, and the physiological needs that change as caregivers age, is important to ensuring our longevity in the profession. Our department specifically created, and our wellness committee specifically created policies around new parents returning to work, protects them from night shifts and eases them into the schedule, allows specific time in specific shifts where things like pumping might be easier. And then we have additional policies that reduce or eliminate the night shift burden for folks in their 50s and beyond. So thinking about what your department might do to support people at different phases in life is essential for really supporting wellness. Workload and recognition, as we talked about before, both significantly impact personal and professional fulfillment. However, that recognition, if applied unequally, is actually going to work against the wellness of the overall group. You know, we need to consider things like the pervasiveness of gender gaps in earning and promotion in emergency medicine. And there are some strategies that are published that can work on reducing those gender gaps, such as redefining productivity, creating innovative work models, and promoting equity through workplace redesign. Similarly, in efforts around equity and inclusion and wellness, if all of the effort comes on the part of the few minority faculty or the few minority champions, they experience the minority tax, which are those extra responsibilities that result from the unofficial ambassador role that they've taken on. And so when we're thinking about policies, procedures, and support, we really need to focus on eliminating that gender gap and avoiding the minority tax. And then this is my final little thing. I know we're running low on time. But as Vitas already mentioned, crisis does occur. Emergency providers, and particularly those from marginalized background, disproportionately experience direct, secondary, and vicarious trauma. And also we experience the moral distress related to the fact that social tasks are increasingly being pushed on emergency medicine as a specialty. And so one of the things that's been suggested is using trauma-informed principles in the workplace. And I have a few things that can be used in your own workplace that we can discuss a little bit later if we have a couple of minutes. But I think taking a trauma-informed approach in the workplace can help increase longevity in the profession and help us to be more well. So in conclusion, if we focus on well-being as individuals, instead of the group as a whole, we can reduce inequities, support diversity, and hopefully enhance belonging in the workplace.
Thanks, Logan. And then again, there's the talk of moral injury. I will just wrap up and say, I love this slide by Dr. Shannon McNamara. If we can do less bad and more goods, then our environment will be better. And so I will leave you with this slide because I think it's very, very important for us to continue to address well-being and professional fulfillment in so many directions and not just one effort, right? I love this picture, so I'm also sharing this with you. We finally just got to meet in person, like all of us, just a couple of weeks ago. So that was really, really cool because we haven't seen each other or never met each other before in person, some of us. So we are at time. Some of us are willing to stay to just answer questions, comments. There's a lot of information packed here. All this to say thank you for all the work that you do. We really appreciate you. Join us in our next SAM committee meeting. This is the one in Austin this Thursday. We also have our monthly sessions. We talk about stuff like this. So if this is an area of interest for you, please join us. Clearly, we're looking for people who will find evidence for the work that we're talking about. Maybe that's going to be you. Join us. And again, thank you so much for being with us. And I'll pause here to answer some questions and also just reflections from people. And also do not feel like you have to stay. So if you have to go because you got to go to another meeting, that's perfectly okay as well. Fantastic. That was 7 seconds. Thank you. Dau, thanks a lot for making sure that this setup is great. And thank you to Stacy as well for really helping us get this webinar up. Thanks, everybody.